Sup, chooms? How y'all living? Hope everything is Nova and you're all having a preem week. Okay, so it looks like we're going to be responding to Dr. Attia again. In case you missed it last time, this will be my second video responding to Dr. Attia because just like before, he's decided to invite a doctor on who fearmongers about finasteride. The last time he did that, I actually took Dr. Attia's side since he showed proper skepticism about many of the claims that his guest made, and he did a very good job at pushing back rather than just accepting his narrative. I'll link that video below in case you're interested in seeing it, and this one's kind of a follow-up, so I do recommend you do that. But Dr. Attia, he's back now with yet another doctor who takes a highly unconventional contrarian stance on finasteride, which is particularly odd since this new doctor is a urologist, and most urologists find that finasteride is one of the most useful drugs they have at their disposal to treat prostate enlargement because it is so effective for that condition. So this time, I have to admit, I'm getting a little bit frustrated with Dr. Attia here. I know he presents himself as someone who is agnostic on the subject of finasteride, so it is understandable that he's inviting on other doctors to talk about finasteride, but how is it that now, 2 times in a row, he's had 2 doctors on who share the opinion that post-finasteride syndrome exists and that people should never take finasteride? If Dr. Attia had ran a history YouTube channel at one point in his career, and 2 times in a row he invited a historian on who denies that the moon landing was real, I mean, wouldn't that also make you question Dr. Attia's motives? So it all seems suspicious since the overwhelming majority of doctors do not believe that post-finasteride syndrome exists. This isn't just conjecture on my part. I actually made a video which goes over data on this particular subject that shows that the medical and scientific consensus is that finasteride side effects do not persist upon discontinuation of treatment, and that video is linked below. So I am not against Dr. Attia wanting to invite doctors onto a show to give a scientific opinion on 5-AR inhibitors, but why doesn't he try inviting a doctor who shares a more mainstream opinion on this issue? I mean, why not try to reach out to someone like Dr. Sinclair or Dr. Trueb, who are 2 extremely accomplished dermatologists who both share the opinion that finasteride is a safe drug and that post-finasteride syndrome is not a real condition. I don't want to make assumptions about Dr. Attia's intentions here, but the fact is that he's now 2 times in a row invited doctors onto his podcast who share these strange contrarian opinions, and it gives me the impression that he's trying to establish an anti-finasteride narrative, maybe because he thinks that viewpoint would be more agreeable with his audience since YouTube is absolutely dominated by attention-seeking contrarian trolls and conspiracy theorists who think finasteride is a big pharma plot from Jewish lizard people from Proxima Centauri to chemically castrate men and promote the white genocide. I don't want to get carried away with a big rant, but why is it that the people within the medical field who hold contrarian positions often get so much more attention than people who hold more mainstream opinions? This isn't just the case with hair loss and prostate drugs. We see this in virtually every single field of health. You look up the mainstream opinion on any health-related issue, and it will always be the opposite position that gets the most attention on social media. Seriously, if you want to know what the popular opinion is on YouTube, just think of any common sense position and then look for whatever the opposite of that position is, and that will be the one that gets the most attention. For instance, let's go to YouTube right now and type in the search bar, vegetables are bad. The first video that pops up in the search is from a channel from some idiot named Ken Berry who has a video with nearly 1 million views which claims that vegetables are bad for you. Now let's try searching for the opposite, more mainstream conclusion by typing in a more positive search phrase like benefits of vegetables. The first video that appears is from a YouTube channel called Independence Blue Cross, and it only has 1/8 the views as the first anti-vegetable video to appear. If you go on any social media platform and look up information on virtually any health subject, the channels that get the most attention are from people who take contrarian positions, and this applies to hair loss as well. This bias towards contrarian ideas doesn't just apply to YouTube. If you go to Reddit and look up one of the most popular posts of all time, it is from some conspiracy theorist who thinks that the cure for hair loss is to eat broccoli sprouts. I made a video about that post, which I'll link below, by the way. But anyways, why is it that fringe opinions get more attention than mainstream opinions? Well, I can only speculate here, but I think a lot of it has to do with narcissism. People like to think they know better than people who are more qualified than them because it makes them feel special. So, in order to feel special, they will delude themselves into thinking that they're smart enough to know something that the vast majority of medical professionals have somehow missed over all these years. You see this with hair loss too. You see people claiming nonsense like hair loss isn't actually caused by DNA DHT, but rather it's caused by factors like scalp tension, the shape of our skull, or because of the placement of our jaw. All these people making these claims are narcissists because thinking you have somehow found some connection which leads to an outcome that decades worth of research from thousands of infinitely more qualified scientists, doctors, pharmacists, and chemists have somehow missed over all this time is the absolute epitome of narcissism. Now, that is not to say that the scientific consensus should never be challenged under any circumstances, but if you want to challenge it, you have to do it the right way. A scientific consensus is something that is established through years of experimentation using well-designed, falsifiable studies. So, you can't challenge the scientific consensus by making random observations, like claiming hair loss is caused by the shape of the skull, since you notice your friends at work who are bald seem to have bigger heads than people who are not bald. It would be like someone claiming the theory of relativity isn't real because Captain Kirk traveled back in time in Star Trek IV in order to save the whales. Anybody can make whatever stupid claim they want about anything, and furthermore, anyone can selectively analyze data to draw a conclusion that best fits their biases. But if you want to actually legitimately challenge a scientific consensus, you have to use the scientific method to prove your hypothesis. This applies to hair loss drugs as well, of course. The scientific consensus on finasteride is that it is safe and that the side effects are not persistent. Yes, I know there are a handful of fringe contrarian doctors like Dr. Trash and Dr. Earwig who believe that post-finasteride syndrome is real, but fringe scientists have always existed in every field. There are scientists today who say that climate change isn't real, or that vaccines can make you magnetic, or that having high cholesterol levels is actually healthy. In every scientific field, there are always going to be fringe opinions, even amongst seemingly qualified people. Sure, you could argue that just because the majority of people believe something, that doesn't make it true, but that is only when we're talking about layman opinions. In the case of what actual scientists believe, instances when the scientific consensus has been proven wrong are exceptionally rare in the modern era. And even when scientists are wrong, they are only slightly wrong, like when Stephen Hawking admitted he was wrong about black holes radiating heat, since he initially claimed that they didn't when they actually do. But there have never been any examples of the scientific consensus in the modern era proving to be egregiously wrong, like it was so wrong that the polar opposite opinion was actually true. Also, it's important to note that scientists will actually admit when they're wrong, since they base their conclusions on the best data available at the time, and they will change their opinions when new data appears. These social media personalities, though, who promote all of these fringe ideas will never in a million years admit their fundamental beliefs are wrong, and that is because they are egotistical ass clowns who base their identities on presenting themselves as knowing better than people who are smarter than they are. These quacks will reach their conclusions by cherry-picking data that ranks low on the hierarchy of scientific evidence, such as anecdotes, rodent studies, or theoretical mechanistic data, and they'll ignore the far greater number of higher quality studies that contradict their view, or they'll gaslight them by claiming that they're tainted by Big Pharma, which goes back to what I was saying about Jewish lizard people from Proxima Centauri. These people thrive on the ignorance and arrogance of people who feel a need to be special by latching onto ideas that conflict with the mainstream narrative, and they deserve no place in the field of scientific research. All these ego-driven contrarians that push these fringe theories can rightly fuck off, especially when it comes to health-related subjects, because health misinformation can kill people, or even worse, make them go bald. I'm not a doctor myself, of course, but that is precisely why I respect the scientific consensus, since I am smart enough to know that I am not smarter than what the majority of scientists and doctors say, and that is why I will continue to promote the scientific consensus on this channel. I sincerely wish that Peter Attia, who unlike me is an actual medical doctor, would hold the same standard for his channel, but sadly, at least in the case of hair loss drugs, he has failed to meet that standard. So, enough of my rant. This brings us to Dr. Attia's newest guest, Dr. Ted Schaefer. The video he's featured in is about prostate health, but as most of you chooms probably know already, finasteride isn't just prescribed for hair loss, it is also prescribed to treat an enlarged prostate, and that is why the discussion between Dr. Attia and Dr. Schaefer eventually comes to the subject of finasteride. Unfortunately, instead of providing helpful information here, Dr. Schaefer instead decides to spread fear and misinformation about finasteride, and unlike with the last doctor he interviewed, this time Dr. Attia disappointingly doesn't call him out for it, so it looks like I'm going to have to do it for him this time. Well, the video is nearly 4 hours long, but fortunately the segment where finasteride and DHT are discussed is only about 10 minutes long, and since that portion of the video is the most germane to the focus of my channel, that is what we're going to focus on here today. So let's get to it and see what these two slaphead MDs have to say about finasteride.
but as we'll talk about, because there's significant pathology associated with taking finasteride. And so we used to think that it was predominantly in those main structures, follicles of your hair, prostate, et cetera. But now we know it actually there's profound potential impact of that centrally in your nerve system, right? And it can affect your sex drive, it can affect your sex performance, et cetera.
So he says there is a significant pathology associated with finasteride. He makes it out that finasteride has these dramatic effects outside of where it is supposed to work. He brings up the central nervous system and also sexual health problems associated with finasteride. So let's address all this, but first let's look at what the data actually says. So it is true that finasteride has a small risk of causing sexual side effects. The exact causation behind this isn't known, but we do know it likely isn't related to DHT, since if that were the case, then everybody would get side effects, since finasteride lowers serum DHT levels by 70%. If you lowered anyone's testosterone levels by 70%, they'd immediately feel significant sexual side effects. So the fact that side effects are so rare with finasteride is likely due to its upstream effects on testosterone to estrogen ratios and not due to its effect on DHT levels. I made a video talking about this and also discussing how to deal with those side effects, and I'll link that video below if you're interested. Dr. Schaefer implies that the incidence of sexual side effects is extremely high, but in actuality, the absolute risk of side effects based on the strongest data available is about 2%, give or take. As far as neurological side effects are concerned, the existence of neurological side effects has never been established definitively, and the claims made about neurological side effects are all based on faulty data. Specifically, the research done on neurological side effects involves rodents. The reason you can't extrapolate rodent data with finasteride is because finasteride in rodents is a potent inhibitor of the type 1 5-AR isoenzyme, which is the 5-AR isoenzyme that is predominant in the brain and responsible for the synthesis of neurosteroids like allopregnanolone that finasteride haters love to fearmonger about all the time. In actual human beings, though, finasteride only has a negligible effect on the type 1 isoenzyme, so any outcome data from finasteride based on rodent studies cannot be extrapolated to human beings. Furthermore, the rodents in these studies were on doses of finasteride which were hundreds of times higher than the weight-based equivalent of what a human being would actually use. In the clinical research done on actual human beings, of which there are many since we are talking about an FDA-approved drug after all, there were no reports of any neurological side effects even amongst thousands of subjects who were compared to a placebo group. Despite this, Merck did eventually add depression as a possible side effect to the finasteride label, but this was done in order to avoid litigation, since oftentimes pharmaceutical corporations have to fight frivolous lawsuits, and lawsuits are expensive to fight whether they are frivolous or not. The FDA itself admitted that the data to support adding depression as a side effect of finasteride was not supported by scientific research, as you can see in this statement right here. If you want to learn more about finasteride and neurosteroids, or about the frivolous lawsuits against Merck, I'll link my videos below explaining them, but just know that the claims that Dr. Schaefer is making here are not grounded in any strong scientific research.
So let's talk about this, because I had never heard of this until a few months ago. Post-finasteride syndrome.
Yeah.
Okay. So why is it that the first person you turn to after learning about this condition is someone whose view on finasteride is completely outside of the mainstream, including in the field of urology, where finasteride is literally the most commonly prescribed drug for treating an enlarged prostate? Why would you do that, bro? It reminds me of when the YouTube channel What I've Learned decided to talk about hair loss, but instead of bringing on an actual doctor to discuss clinically proven therapies based on sound methodology, he decides to bring on a medical editor who claims that you can stop your hair loss by rubbing your head for 40 minutes a day, and I'll link my video on that one below too.
So we talked earlier about finasteride. When it's taken in a drug called Proscar, 5 milligrams a day, it has a cousin called Dutasteride or Avodart. I think that's 0.5 milligrams per day.
Yep, that one theoretically is more potent because it blocks 5-alpha reductase 1 and 2.
Okay.
But the efficacy is equivalent in the human body.
Okay.
So just to clarify, dutasteride is a more potent drug than finasteride, at least when it comes to hair loss, and I've made several videos about that, and I'll link the most recent one below. I think since this topic is on urology though, maybe he's speaking about these drugs in the context of prostate health, and I am a layman on that subject, and it isn't something I really care enough about to fact check, so I'll ignore that. The name of the channel is Hair Cafe after all, not Prostate Cafe, but just know that when it comes to hair loss, dutasteride is the more potent drug.
It's a little bit of a scam that these drugs are taken daily because their half-life is quite long, right?
Yeah, they all have a very long half-life. So if you took a single finasteride 5 milligram dose, it's generic, so it costs nothing anyway.
Yeah.
But if you took that, it would hang around in your system for a week or two. But you could take, I haven't worked it out. You could probably just take a single 5 milligram of finasteride once a week, and that would be the same as 1 milligram of the other stuff every day. It has a much longer half-life than anyone appreciates.
So this is actually incorrect. He said that finasteride has a long half-life, which isn't true. Finasteride's half-life is only about 5 to 6 hours long. Dutasteride, on the other hand, does have a long half-life, about 5 weeks in fact. Anyways, what he may be referring to here about finasteride is that its biological effect on blocking the 5-AR enzyme does last longer than its half-life. This is why the drug can be taken daily or even every other day and still be effective. But just because a drug has a prolonged effect doesn't mean it is as effective as taking it daily, and it doesn't mean that the prolonged effect is as effective on the 7th day compared to the 1st day, for example. So, while less frequent usage of 5-AR inhibitors is an option for people who don't respond well to daily use, these drugs have not been studied at frequencies of just once per week, so it isn't really prudent to make a weekly dosing recommendation which has never been clinically validated. Also, the fact that he's using the term half-life when he's actually referring to biological effect does seem to be pretty sloppy for a doctor, because half-life has a very specific meaning in science. It's how long it takes for the blood level of the drug to go down 50%, and in the case of finasteride, it is only 5 to 6 hours, as I said, and it's not a week or more like he's implying. So I know what he's trying to say here, but his terminology is misleading and it is sloppy.
Okay.
So the idea that the reason it was reformulated at 1 milligram versus 5 milligrams was for new patent, new indication.
Yes, of course.
I agree with this. Research has shown that finasteride's efficacy peaks at 1 milligram daily, so using anything more than that for hair loss will not give any additional benefits, and I talk about that in my optimal dose of finasteride video, which I'll link below. To be fair though, Merck didn't just randomly come up with the 1 milligram dose as an excuse to file a new patent. This was based on new research showing that 1 milligram was adequate for treating hair loss. So 1 milligram is what is prescribed since anything more isn't necessary. That's all.
That's the least of the problems that I think is associated with this drug.
So let's get to the issues, because this is also a very controversial topic, right? There are people that get up in arms on both sides of this discussion. So describe what post-finasteride syndrome is.
Post-finasteride syndrome is not a controversial subject outside of the realm of the internet drama you see on places like Reddit, 4chan, and World of Warcraft armchair researchers. Post-finasteride syndrome isn't something taken seriously by the majority of researchers, and it is not the scientific consensus. Just because there is a cabal of loud, angry, violent, basement-dwelling permavirgins who take their sexual frustrations out on finasteride doesn't mean we need to take their grievances seriously, much in the same way we don't need to take an organization like QAnon seriously. No one is denying that finasteride has a risk of causing sexual dysfunction. Finasteride is a prescription medication, and any doctor who writes a prescription will inform their patients of the risk. Every drug has a risk of side effects, so for each patient, it is a matter of determining if the risk-to-benefit ratio is worth it for them. Personally speaking, I'd much rather have a 2% risk of reduced libido over a 100% chance of going bald, which is what would happen if I didn't take finasteride. If someone doesn't think the risk of finasteride is worth it, fine, that's their decision. Say hello to Bald Cafe for me. But this guy implies that these side effects are common and they are irreversible, which isn't true.
But there's a lot of other associated findings with it, like depression, just general change in your affect. So those are harder in my mind to attribute to medication, but
So he does mention that it is hard to attribute something like depression to medication, and that's true because symptoms like depression and even sexual health problems are very common conditions amongst the general population, even amongst young people. So just because someone took finasteride in the past and now has depression or sexual health problems doesn't mean finasteride is what caused it.
Well, it's a variety of symptoms that men will complain of after taking either, the BPH dosing or the kind of hair loss dosing of these medications. Decreased sex drive, impotence.
Okay, Okay, that's true, but the incidence is low and the side effects are reversible. In fact, in the majority of people, the side effects will go away even if you continue the drug. So if you get these side effects, chances are it's just your body adapting to the drug and they will go away after a month or two as you continue using the drug. Even if they don't, they will always go away if you stop the drug.
And what do you think is the approximate frequency of this post-finasteride syndrome?
Yeah, that's probably where there's more debate, right? I think, and some people would say 5%, some people would say 15%.
And some people would say 0%, like the majority of doctors, which I proved in my video, which shows that the majority of doctors, when surveyed, do not believe that post-finasteride syndrome is a real condition. Both of these doctors are also conflating having side effects with having post-finasteride syndrome. Nobody denies that finasteride can cause sexual side effects, but the existence of sexual side effects doesn't mean post-finasteride syndrome is real, and Dr. Schaefer is pulling this 5 to 15% number out of his ass. Maybe he came across some shitty study funded by the PFS Foundation that shows an incidence this high, but the highest quality research shows that the incidence of side effects from finasteride is about 2% higher than placebo. So the absolute risk of finasteride side effects is only about 2%. The only reason it may seem higher than that is because of the squeaky wheel gets the grease phenomenon, which purports that the loudest voices drown out the more subdued ones, which makes perfect sense. Most people who take finasteride and have a good experience with the drug are just going to enjoy the benefits of the drug and get on with their lives, while the few who didn't or who are too dickless to use finasteride are likely spending all day on Reddit screaming and harassing at anyone who speaks positively about the drug.
I mean, it depends on where you look, but I think about it like 1 in 10 guys will have appreciable issues with it.
1 out of 10 men. What is this based on? It can't be based on his own medical practice because, as we'll find out later in this video, he doesn't even prescribe finasteride despite being a urologist and finasteride being the most commonly prescribed drug to treat an enlarged prostate. Also, in his practice, he's not treating young men with hair loss. He's treating older men with prostate issues. So the statistic he's bringing up is probably just based on some Reddit post he read one day or something he's just imagining because it isn't based on any appreciable, medically validated statistics. If he's talking about post-finasteride syndrome, then even the PFS network doesn't claim that it affects 10% of all finasteride users. Even they admit that PFS is extremely rare because if it were more common, then more people would take it seriously. So this guy is on the fringe of even the PFS network.
But I definitely see it. So it's why I never really use it in my practice.
So he sees it, but he never uses finasteride in his practice? How do you see it if you don't prescribe it? So this is just secondhand information he's getting on finasteride, but he's actually taking it seriously. If Dr. Attia wants to learn more about finasteride, why would he invite a doctor onto his program who doesn't even prescribe the drug? This doctor has had no firsthand experience treating patients with finasteride, so what he knows about the drug is no greater than what anyone else knows about it, because everything he's basing his opinion on is just secondhand information he gathered by just Googling what other people say about it online. Dr. Attia, there is nothing this guy can tell you about finasteride that you can't just learn yourself by doing your own research. So what was the point of bringing up finasteride at all? So since he doesn't prescribe finasteride, these can't be people that he actually treated with finasteride. So how does he know that their problems are caused by finasteride and not by some other factor? After all, he is a urologist, so he's obviously going to be seeing a lot of people who claim they have sexual problems, since that is probably the main reason many people will see a urologist to begin with. Some of these people may have taken finasteride in the past, but that doesn't mean that their sexual problems were actually due to finasteride. I'm sure he sees plenty of people with sexual problems who have never taken finasteride before in their lives, so why is it that a patient's past use of finasteride implies that finasteride is what is presently causing their problems? It doesn't make any sense to me. There is no logic behind any of these claims. Sexual dysfunction by its very nature can be persistent, and its causation is highly multifactorial, which is why it's so common. In young people, it is mostly psychological, and that is not to say their sexual dysfunction isn't real, but there is definitely a huge psychosomatic component to sexual dysfunction within young men.
But there are people that I know who have it, permanently.
Yeah, there are case reports, and that's the really scary stuff, which is the case report of the guy who goes to see the hair doctor. They put him on finasteride. He experiences all of these symptoms. They're horrible, and they're very noticeable because he's 25 or 30. He stops taking the drug, and it never comes back.
Yeah.
This case report doesn't establish causation, but if I had to speculate as to what actually happened, here's what I think may have caused it. Finasteride does rarely cause sexual dysfunction. We know that. That's not in dispute at all. So I think when people claim to have post-finasteride syndrome, what actually happened is they got side effects while on the drug, like sexual dysfunction, and this may have led to a bad sexual experience which was so humiliating for them that their confidence was permanently shaken. I think these failed sexual encounters they may have experienced could have been so traumatic for them that it caused them to establish a negative emotional attachment to sex itself, so much so that many are just too afraid to even attempt to engage in it ever again out of fear of something so humiliating ever happening. As such, they have extreme performance anxiety issues which prevent them from being able to perform sexually. It is possible for people to develop a negative view over something which is otherwise seen as pleasurable or positive because of a past traumatic experience. Like, for example, if somebody were sexually abused as a kid during their birthday party, they may get PTSD as a consequence of that, and PTSD symptoms may show up every time a birthday party comes up for them, even though most of us usually have a positive emotional attachment to birthdays, which is why they usually entail things like celebrations. I don't want to get too carried away with this point. I just want to bring up the very real possibility that one bad sexual experience as a result of a side effect from a drug could be very traumatizing. So traumatizing that it can cause you to believe that you're continuing to have sexual problems for physical reasons and not psychosomatic reasons. And I think organizations like the PFS network are harmful in this regard because they convince people that there is no hope for their problems when in reality, maybe they just need some counseling. Ryan Russo, I hope you're watching this.
Is there any sense of what predicts susceptibility to this?
It's a good question. You know, it's a post hoc diagnosis. I haven't seen a great paper that really took 100 or 500 men and really tried to evaluate what it was that would predict it. So, I'm not aware of any high quality study that can help predict that association.
The reason why you can't predict it is because there is no good prospective data on it to begin with. There is no prospective study that found any incidence of persistent side effects because the data is all based on just anecdotes and retrospective studies. You can't find predictors when you're trying to predict something that doesn't happen. So maybe prove the condition with a prospective randomized trial first, and then after that, maybe then you can find some predictors.
Would you be comfortable then, and feel free to say no, but would you be comfortable recommending to a patient who's considering using a 5-alpha reductase inhibitor for hair loss that they might be better off looking at other medical and non-medical therapies for hair loss?
Yeah, I mean, I don't recommend it for use in any man. If it's one
BPH or otherwise.
Yeah. Why, if you're taking it for hair loss, which I experienced at a very young age, so I know what that feels like, and it can have a real impact on a young individual's life.
I agree. He definitely does know what that feels like, which makes it all the more perplexing that the hair loss advice he's about to give young men here is about the worst hair loss advice imaginable.
There's a lot of really effective therapies that you can do. I mean, hair transplant works very well. It's very precise, and I know people who've done it, and they're very satisfied with it. So I think there's alternatives.
He mentions there are lots of alternatives, but then the only one he can name is hair transplants. Hair transplants, I'm sorry to say, are not a form of hair loss prevention. Even if you do get a transplant, you're not actually regaining any hair. You're just redistributing it in a way that makes it look more cosmetically appealing. And even if you do get a transplant, it is not going to stop the non-transplanted hairs from falling out if you don't use finasteride. You can still get progression of hair loss in the non-transplanted hairs, and you can even experience some additional hair loss in the transplanted hairs because the donor region where hairs are harvested are DHT resistant, but they are not DHT immune, which is why you see some extreme Norwood 7s who still have diffusion in their horseshoe pattern. Also, hair transplants are prohibitively expensive most of the time, especially for young men. People will often try to save money by going to cheap Turkish hair mills, but the results can be so bad they probably look better if they just went bald. Telling people to avoid hair loss medication and just get a hair transplant is horrible advice. The best option is to make sure you never need a hair transplant to begin with, and the way to do that is to get on treatment before losing ground, not waiting until you need a transplant. Hair transplants, of course, have their place, but they are no substitute for drugs. He doesn't give any other alternatives besides hair transplants, which is probably a good thing, because based on what he said so far, he'd probably start recommending some woo treatments like scalp massages or broccoli.
I think understanding what that spectrum of alternatives is really important, because when young guys go to these kind of pop-up shop clinics, they're not given the full kind of...
They don't have a consent with this.
Yes, and they don't understand what the long-term effects are.
I don't know what he's talking about when he talks about pop-up clinics, but you can get a prescription easily for finasteride by just talking to your doctor, and your doctor will inform you of all the potential risks. So I don't know what he's talking about with his pop-up clinic thing.
Because in addition to the post-finasteride syndrome, as a prostate cancer, biologist and an individual who treats people with prostate cancer, the other big thing has to do with what its effect is on your PSA value. So it halves your PSA value if you take the medication for 1 to 2 or 2 to 3 years. And after 5 years of being on the medication, it reduces your PSA number by about 2.5x. So
that does not come back?
If you stop the medication, your PSA will rise. But the biggest issue is not whether or not it suppresses your PSA or not. It's lack of awareness that it does amongst the patients and the providers.
So now he's bringing up PSA levels, so let's take a moment to just talk about what that is exactly. PSA, it stands for prostate-specific antigen, and it is a screening test for prostate cancer. The PSA level goes up if you have prostate cancer. It is a test done mostly in older men, and is not done routinely in young men just because prostate cancer is very rare in young men. So, it is well known that finasteride decreases the PSA by about 50%. Doctors know this, especially doctors who are checking PSA levels. So, most older people who start on finasteride for an enlarged prostate have a baseline PSA level done, and if it does start going up on finasteride, it is an indication of possible prostate cancer. So it is clear that Dr. Schaefer has disdain for his fellow practitioners who work in these so-called pop-up clinics, and he thinks they're not smart enough to figure out that finasteride will lower their PSA and be able to take that into account. He's also just picking on finasteride because, as it turns out, finasteride is not the only drug that lowers PSA. Common NSAIDs like Motrin and naproxen, as well as statins, and even certain diuretics lower the PSA level. So there are plenty of commonly prescribed drugs that affect PSA levels and might cause difficulties with prostate cancer screening, but most doctors are already aware of this and will take this into account when prescribing finasteride. Hopefully Dr. Schaefer wouldn't suggest that a heart attack patient should avoid taking a statin because of its effects on PSA levels, but he is saying that doctors shouldn't prescribe finasteride for the very same reason, which doesn't make any sense. He's clearly just anti-finasteride for the sake of being anti-finasteride because he probably thinks it gives him a sense of superiority, thinking that he knows better than the rest of his peers who work up in these pop-up clinic doctor's office, as he claims. Also, like I said earlier, for most people, PSA screening isn't even recommended until you're over the age of 55. So, the majority of people taking finasteride for hair loss are not going to be in that age group, so they're not even going to have that test done to begin with. So, this information is completely irrelevant to the vast majority of hair loss sufferers. If you are in the age group and you are having PSAs done, then just make sure your doctor knows you are on finasteride and be aware that finasteride does lower PSA. It doesn't render the test useless because the PSA level will still rise if you get prostate cancer, but it will rise from a lower baseline if you're on finasteride. So it's basically just an issue of applying a different standard to the test, and so long as there is transparency, there will be no problems in screening with the PSA. This is a complete non-issue that serves no other purpose other than to fearmonger about finasteride.
You take finasteride starting at age 25. You start at age 25 and it's your PSA is 0.5. Think about this. It may begin to rise, and it goes between, let's say now you're 50, so 20 years later, it goes between 0.5 to 1 to 2 to 4. That's 4 years where your PSA is doubling, which tells you got a really bad problem before it's even anywhere near being on the radar of the patient or their internist.
Like I already said, practically nobody is getting a PSA at the age of 25, and even when you start to get them 30 years from now, you won't have any issues whatsoever. You'll just start with a different baseline which your doctor will know about since he will know your medical history. Dr. Schaefer is implying here that finasteride somehow hides your PSA levels, but it doesn't. It just sets the baseline lower, and increases above that baseline are still valid indicators for the risk of developing prostate cancer.
And this says nothing about the other issue, which is not having DHT probably isn't a good thing if you're in the business of taking advantage of your androgen receptors, right? You're taking away the most potent androgen in the body, and androgens do really good things.
Yeah.
So I don't know who Dr. Attia has been speaking to since his last video, but he was much more reasonable and capable of critically analyzing claims back then than he is now. Now all of a sudden, it seems like he's getting his talking points from the Ray Peat forums and naturalnews.com. DHT being a potent hormone doesn't matter in the slightest because the nature of that hormone in the human body is paracrine, not endocrine, meaning it is active specifically in the tissues where it is produced, where it does all the horrible things it is known for doing, like hair loss and enlarged prostate. Serum DHT levels are not high enough to have any testosterone-like effects in the human body, which is why most people can suppress it without any issues whatsoever. If DHT were a critically important hormone, then everybody would get side effects from finasteride since it lowers serum DHT levels by 70% after all. As I explained earlier, nobody would be able to suppress 70% of their testosterone levels without side effects because testosterone, unlike DHT, is an endocrine hormone which is essential for virility.
I mean, I think absolutely. I mean, the impact on a man, I mean, the extreme examples are those individuals with no testosterone. We induce that in individuals with advanced prostate cancer, and there are rare cases for men who are born with no testosterone at all. But in general, yes. I mean, for a healthy man, you know, it's absolutely imperative, in my opinion, that you maintain a, you know, eugonadal state. And that's debatable what that means, but I think, in my opinion, you can titrate to a functional eugonadal state in almost all men if their testosterone levels are low. But having testosterone around is just critical for
everything from metabolic health to structural health.
Everything, really for everything.
And probably mood and a whole bunch of other things.
All that, exactly.
Okay.
So this is a classic bait and switch you just witnessed here, because Dr. Attia brought up DHT specifically, but then all of a sudden, Dr. Schaefer quickly changes the subject to testosterone. Not all androgens do the same thing, so you can't just lump DHT in with testosterone when talking about the importance of testosterone. They are different hormones with different roles in the body, and there is no parallel with low testosterone versus low DHT levels. Even Dr. Attia forgot his own question. He was asking about the importance of DHT, and all of a sudden, they switched the topic to testosterone. No shit, testosterone is important, but DHT is not testosterone, and suppressing DHT does not produce the same outcomes as suppressing testosterone. Otherwise, finasteride would not be a viable option for treating hair loss.
Now let's talk about the relationship between testosterone and DHT and the development of prostate cancer.
Then they get back to the topic of prostate cancer, which is an interesting thing, but it's not really the focus of this channel, so I'll go ahead and conclude it here. If you want to learn more about finasteride's role with prostate cancer though, I did make a video about that and I'll link it below if you're interested. But to sum things up, this was a pretty disappointing video by Dr. Attia. I want to give him the benefit of the doubt though, because I know that during live discussions when people are on the spot, they may not have the time to critically analyze everything being said on the fly, so it is possible Dr. Attia is looking back at this and cringing. It's also possible Dr. Attia was more reserved than his skepticism for the sake of being polite, since he doesn't really strike me as the type of person to have a combative demeanor. I'd really like to see him revisit the subject again, but maybe this time he should consider inviting a doctor onto his show who actually has experience in prescribing the drug and therefore can give his viewers a more first-hand perspective based on his experience in treating patients. Bringing a doctor on who is anti-finasteride and has never prescribed the drug is not helpful. There is already plenty enough anti-finasteride content online as it is, and we don't need any more of it from Dr. Attia's channel. So, no hate towards Dr. Attia. Honestly, I still like the guy, and I think his channel does more good than harm, but I think his viewers deserve better than what he gave them in this interview. He was much more skeptical last time with the last anti-finasteride doctor he interviewed, and if you guys remember the video I did on that, I gave Dr. Attia plenty of praise. So I'm hopeful this interview was just Dr. Attia having an off day, because you know that can happen to anybody. Anyways, hopefully this response video helped clear up some of the misinformation spread by this video, and I'll be back with more regular content soon. So thank you for watching my fellow hair loss witchers. God bless.